students, today we'll be discussing the non-surgical treatment part of gingival recession. In non-surgical treatment, first of all, correction of brushing technique will be there. If a defective brushing technique is there and because of that gingival recession is there, we have to educate the patient about the proper brushing technique. So correction of brushing technique will be done first. Removal of masochistic habit. If patient is having some habit of self-inflicting gingival injury, then we have to address that and we have to remove that habit. Correction of malocclusion is done treating dentinal sensitivity. If sensitivity is there because of gingival recession, then we have to treat that. And later on, the last point is construction of gingival mask. The gingival mask is recommended to the patient in which multiple gingival recessions are there, and if black triangles are there, in this case, and in also in cases where surgical treatment is contraindicated, then we can go for flexible silicone gingival mask. This is a case of multiple gingival recession, interdental bone loss and soft tissue loss is there, and this is the post-op result when gingival mask is given. So this is how gingival mask look like. It look like healthy gingiva in which gingival stippling, festooning pattern is there. So this is the picture of pre-op gingival recession in which generalized gingival recession is there, and the pic after gingival mask is delivered to the patient. This is done basically to improve the aesthetic appearance of the patient. Indication of gingival mask: to cover exposed crown margin, exposed implant component and root surfaces and reduce the length of the clinical crown. To block out the black triangle between teeth in which gingival recession has occurred. See, this area, this is known as black triangle. This area is known as black triangle and it looks unaesthetic. In order to cover that area, we also recommend gingival fabrication of gingival mask. In this impression, we have to take the impression of the patient and send this impression to the lab where the gingival mask is fabricated, and later on will deliver the gingival mask or gingival veneer to the patient. So it is recommended to cover exposed crown margin, to block out the black triangle, to fill the space between the crown, the fabricated crown and the soft tissue. If space is there between crown and the soft tissue and the black triangle is there between crown and the soft tissue, then also we can recommend the gingival mask. To prevent airflow, in order to improve the phonetic of the patient, then also we can give gingival mask to provide increased lip and cheek support for the patient, and to hide the dark line around old crown that are often seen with the patient who have experienced gingival recession. We can give gingival mask. Gingival masks can be fabricated with acrylic, porcelain, composite, and out of these, silicone based material, they are more suited because they have gingival like appearance, and it is flexible material, and it is very easy for the patient to wear this. The mask will use the support of the lip and the moisture of mouth to remain securely in this space. So next topic will be discussing surgical treatment of the gingival recession. Thank you.